my name is Ashley Duschel. Today the proposition that I'm going to refute is the Affordable Care Act will have a negative effect on young Americans' health insurance. And his three secondary claims were: 1, the Affordable Care Act increases the cost of insurance. 2, the Affordable Care Act unnecessarily increases the breadth of coverage. And 3, the Affordable Care Act imposes penalties for noncompliance. My proposition is the Affordable Care Act will not have a negative impact on Americans' health insurance. My first secondary claim is the Affordable Care Act decreases the overall cost of insurance. So they're going to be lowering the cost of premiums, and the Center of American Progress states that we estimate on net the combination of provisions in the new law will lower premiums by nearly $2,000 per family. Without reform, premiums are expected to increase $13,305 in 2010 to $21,458 in 2019. Relative to this increase, premiums under reform increase only 3/4 as much. By 2019, family premiums are nearly $2,000 lower. Adding reductions in out-of-pocket costs and lower taxes for Medicare and Medicaid will result in estimated savings for the typical family of over $2,500 that year. Increase in actuarial value provides for better coverage. According to the Kaiser Family Foundations, as plans increase in actuarial value, bronze, silver, gold, and platinum, they would cover a greater share of the enrollees' medical expenses overall. The levels of coverage provide for a PPACA are central to the coverage people will get and how they will ultimately perceive the effects of the health reform law. But an actuarial value is not as intuitive for people as certain deductibles and out-of-pocket costs. Additionally, estimates of deductibles and other coverage features were not released by the Congressional Budget Office during the legislative debate. Increasing the age band ratio will allow the price of health insurance to be evenly displaced among age groups. The Robert Wood Johnson Foundation claims the use of the 3-to-1 band designed by HHS results in age-based premiums that more accurately match age-related costs among likely purchasers than a looser rate band. The now common 5-to-1 age rating tends to undercharge young adults relative to their actual health care expenses and to overcharge older adults relative to theirs. My second claim is the Affordable Care Act broadens coverage to necessary areas. According to the Obamacare facts, essential benefits cannot be subject to lifetime or annual dollar limits, and all non-grandfathered health plans must limit the total out-of-pocket costs enrollees pay for in-network essential health benefits. While you may have to meet a certain amount of out-of-pocket expenses, which is your deductible, before essential benefits are covered, the Affordable Care Act prohibits health plans for grandfathered and non-grandfathered health plans from imposing annual and lifetime dollar limits on essential benefits. Obamacare exchanges will lower premiums. The Obamacare facts states that even though we don't know the exact cost of insurance brought through the health insurance exchanges, the Obamacare exchanges will on average lower the cost of health insurance premiums by 7 to 10%. My third claim is the Affordable Care Act imposes affordable penalties for noncompliance. The individual mandate is minuscule according to Obamacare facts. The penalty is prorated for the number of months you are without health insurance. There is no penalty for a single gap in coverage of less than 3 months in a year. Subsidies will provide a relief for the cost of insurance. Obamacare facts say subsidies are only offered through the marketplace and help reduce premium costs and lower out-of-pocket expenses. Americans making under 400% of the federal poverty level can get a type of subsidy called advanced premium tax credits. Tax credits lower premium costs. Those making less than 250% get subsidies to lower out-of-pocket costs, and those making less than 138% may be eligible for Medicaid. Subsidies are only available through their state's health insurance marketplace. So in conclusion, my 3 claims were: the Affordable Care Act decreases the overall cost of insurance, it broadens coverage to necessary areas, and it imposes affordable penalties for noncompliance, which all support that it will not have a negative impact on young Americans. Thank you.
No, lucky us, 2 ACA speeches back to back. The claim that you're responding to and the secondary claims were clearly labeled. Most of your argument develops as a counterclaim arguing why costs are going to be lower. So you proceed with basically like a counterpoint argument. There's almost no discussion of the evidence or the reasoning that the advocate used in their point. We just have the alternative claims that are being presented, the counterclaims that are being presented to suggest that they're going to have the lower costs. I think that's a little bit of a problem because rebuttal arguments, if they are successful, can be very effective, but they have to make sure that they directly address the secondary claims of the advocate. And once we get past that preliminary review of what the claims are, none of your points are being directly applied to any of those claims. So the audience listening is going to have to try and remember what those claims are and try to make the applications. And I think that you miss a trick in being able to apply that. Now, you do present good information on suggested declining costs. Sometimes the information gets a little bit complicated because of the way it's being presented. When you start describing what the different values are in the plans and what the medical coverage is, and you mention a PPACA, I'm going, okay, well, I got a vague idea what's going on here. How does that fit into the argument? I didn't think that was as clear as it needed to be. There's a discussion about what out-of-pocket costs are, basically deductibles. Okay, I understand that. And then there's also an argument where you talk about the age bias, 5-to-1 versus the traditional 3-to-1, and I'm going, okay, now what does all of that mean? Because I'm getting these statistics and what the ratio is. How does that impact the cost? So are we subsidizing older care by charging more to younger people, or are we it sounded like at one point you're saying we've been subsidizing younger care by charging older people more. So how does the Obamacare or the Affordable Care Act change those ratios? It's not clear how that comes about. I know that the claim is that it's going to change those, but it's not clear how we get to that particular conclusion. So I think that was a little bit problematic. The discussion about what the coverage are, what the coverages are and what the advantages are, it's going to change out-of-pocket costs. There's no limitation on lifetime benefits. I thought that's pretty clear, but how does that address the cost issue? And the piece of evidence that you provide on this is kind of contradictory. It says we don't really have the data in order to estimate costs, but we're going to have a 7 to 10% reduction in costs. How does this group that came up with this figure this out if they don't have access to the data? That is not clear to me, and as a listener to the argument, that's befuddling. So you want to make sure that you don't run into an issue where your own evidence seems to be contradicting itself. The other argument on gap coverage and penalties and subsidies, without an example, I think it's a little bit confusing. So we're at 400% of the poverty rate, but if you're only at 138% of the poverty rate, and I'm going, okay, so what does that mean? How much money do I have to be making, and how much of a subsidy do I get? I think that we're being given numbers that are not being explained, and without that explanation, a casual audience is going to listen to this, their eyes are going to roll back and go, what the hell am I getting into here? I got to get on an exchange and find out what the percentage is that I'm going to be eligible for a subsidy on. I'm really looking forward to all this. It sounds like I'm doing my taxes a second time, and that's going to be a, will we? You need to give us an example that shows us how that's going to produce this particular benefit. So, for instance, just a single example. Here's a family of four at $40,000, which is at 150% of the poverty rate, or it's at 200% of the poverty rate, whatever that happens to be. They'll be eligible for this amount of subsidy, which means that their effective cost will not be the $15,000 that's listed. It'll only be $7,000, which is cheaper than what is currently available to them. Okay, that would make sense. That's the way it needs to be explained. As it is, it just sounds like accounting tricks. All right. Thank you.